Guidance from other partners is of fundamental importance to a programme like STEER. So I caught up with Jacquie White from NHS England to find out what she makes of it. So Jacquie, from a financial point of view, what sort of impact do falls make on NHS budgets?
It's estimated that unaddressed falls hazards cost the NHS approximately £435 million every year, and emergency admissions for people over 65, approximately 250,000 every year, so it's a significant impact.
And what happens if we don't address this issue now?
We've had fantastic advances in healthcare, great news for all of us, but it does mean that as we get older, we get more long-term conditions, including frailty, and therefore people need more health and care. If we don't get serious about prevention in the NHS and with partners, we aren't going to be able to sustain the level of support we need to for people as they get older.
Where does the Fire and Rescue Service come into this? How can they be strategically used to help address these problems?
There are significant common risk factors between fire, health and other public services, things like multimorbidity, cognitive impairment, obesity, physical activity. All of those things really contribute to increasing demand on services. So if we work better together, we can do much more effective interventions. We're working with the fire service in England to really focus on how the home safety checks, the 670,000 that are done every year, can be broadened out to focus not just on fire risk, but also on health and well-being, and look at things like falls risks, like social isolation, like loneliness. And it's proving to have significant impact. There are approximately a quarter of people identified through those visits at being at risk of falls. And services such as Hampshire and the STEER programme are being extremely innovative in offering programmes that are evidence-based exercise programmes to help reduce the risk of falls for people.
How innovative do you think STEER is?
Evidence-based exercise programmes have been provided in the health sector for a number of years. What's innovative about the STEER programme is the fact that it is provided, delivered and presented by the fire service. We know that fire personnel have a hugely strong brand. We know that they have huge credibility with people in terms of the support that they give to local communities. So broadening out the option around provision of evidence-based programmes through providers like the fire service gives us a much better appeal and potentially better results.
Who is the STEER course targeting and who's it engaging with?
It's potentially reaching different people to what the traditional health service programmes would. So quite often older men, men who don't access services, widowers for instance, but also people who like to have a group-based approach to support and often have that ongoing peer and mentoring community development that comes as a spin-off from this. So we're seeing all sorts of positive results, I think, that will be both quantitative in terms of reducing risk of falls and improving balance and improving people's physical activity, but also some real social capital out of this, such as that community development I've just mentioned.